Hey everybody, this is Dr.Dan Findlay here at Chiropractical. Today I'm going to discuss with you some home remedies to help yourself out with Achilles tendonitis. And as always, videos like this aren't designed to replace a healthcare practitioner, especially with something like Achilles tendonitis. If it's allowed to become chronic, it can be prone to tears or even full rupture. So you do want to be careful with this. But a little anatomy here to start. Your Achilles tendon connects your calf muscle here in the back part of your leg, and it attaches down into the heel bone in the back here. And when the Achilles tendon becomes irritated, the pain can present either here in the tendon itself or down in the back of the heel. And the pain in the back of the heel can be pretty sharp as well. Some people even describe it as the heel bone kind of ripping apart. Now, Achilles tendonitis quite often is caused by an increase in activity or repetitive use. So either through sport or picking up running or a new exercise that taxes it more. Sometimes it can even be caused by ill-fitting footwear, such as a shoe where the heel counter rubs into the back of the Achilles tendon, or even a sandal strap that rides a little bit too high in the back of the heel. So in that case, you just need to get some different footwear. Now, one of the first things you should do with Achilles tendonitis is rest it. You can do this quite simply by putting your foot up on a table, and you want to make sure that you ice it down. So just rest your foot on the ice pack. You want the ice pack to cover the back of the heel as well as the Achilles tendon, and you want to ice it in a set of 3. So 10 minutes on, 10 minutes off, 10 minutes back on. You want a deep cooling effect. Just make sure you don't give yourself frostbite. Now, to rest it, you also will need to reduce activity if you've increased your activity or if you're engaged in sports as well. So that just means basically do less. Another way to take tension off the Achilles tendon that can be done only in the short term, so for a week or two, is to put a heel lift in the bottom of the shoe. This raises the heel, puts a little bit of slack in the Achilles tendon, and allows it to have a break as well. Now, if you have any sharp or severe stabbing type pains in the back, you're likely going to need to take a complete rest break from sport. And again, this is just going to take longer to heal. You want to ice it up very well, especially we're going to go through some other methods here, but if you do some deep stretching, massages, stuff like that on the back, you want to make sure you ice it up after those as well. So when rehabilitating anything, we want to do flexibility and strength. So to start here with the Achilles tendon and the calf, to do our calf and Achilles stretches, there's 2 ways to do the first stretch here. One, wearing a shoe, you can put your foot up against the wall and then bring your hips up closer to the wall. Another way to do the same stretch is to have the ball of your foot on the edge of the bottom stair in a staircase and to drop the heel down from the stair, keeping the knee straight. So you can do either of these 2 stretches. To add in the second stretch, just continue to do the first stretch and then bend the knee a little bit. You'll feel the stretch change, so it's not up in the belly of the calf muscle. It'll be down lower, kind of on both sides of the tendon now in the soleus muscle. You want to hold these stretches for 30 seconds. You want to repeat them 3 times, and you want to do this daily. Now, continuing on with strategies to loosen up the calf and the Achilles tendon, we can do self-massage. So for the tendon here in the back of the heel, you want to use your hand and do cross-friction massage. So this means you're going across the length of the tendon. This can be quite tender, but it is very effective. So we want to start on the heel bone itself, and we want to move across the skin on the back of the heel with a firm pressure. And then we want to come up into the actual tendon itself. And you can do one side at a time, or myself, I actually like to almost pinch the tendon so you can get your fingers behind it a little bit and then pull all the way up and all the way down. And you're kind of pulling the skin back and forth past it, and you're going to move all the way up until you start to get up towards the muscle. Now, when you get up into the muscle area, you can just use your hand. You can either use the tough part of your hand at the bottom, or you can even just use your thumb, and you just want to sequentially work your way through the calf from the bottom all the way up to the top. All right, now if that's not good for you, there are also some other strategies that are a little bit more creative to help get into these different areas. So first, you can also use a ball, and you can use this to try to get into the side of the Achilles tendon. And you can do it by either dragging the ball past and over the tendon, especially if you have a sock or a pant on top of it, or you can kind of roll the ball through these areas. And up into the calf, likewise, you can drag the ball through these areas to massage the area, or you can roll it around in that area as well to help massage the area out. Another strategy is to use a foam roller. So here, You want to sit down on the ground. Foam roller is going to be underneath the calf. You want to cross the other leg over the calf to put a little bit of extra pressure on it. And then you just want to roll the body back and forth. And you want to do most of the pressure while you roll the leg down over top of the roll. So the roll is essentially rolling up the leg, which pushes the blood back up towards the heart. This helps prevent the formation of varicose veins in the leg, which I'm sure you will all agree is a good thing. Another way to simulate a foam roller, especially if you don't have a foam roller, is just to use a rolling pin at home. So here you can put the leg back up on a bench or a chair, and you can just roll the area out. And again, we want to roll from the heel up towards the calf, pushing the blood back up towards the heart for the same reason as we just discussed with the foam roller. Now, for the Achilles tendon here, to help get in the side a little bit better, you can also use a crescent wrench. A cool thing about this is for people with different size legs and tendons, you can pick the wrench that fits you best. And a little bit of cream or a little bit of oil helps out here as well. And you can kind of scrape up the side of the tendon. Again, this can be quite tender for the Achilles tendon, but it does help loosen things up quite well. And lastly, if you find you're in a place where you need to loosen this up and you don't have any of these other aids, you can just use an edge, whether it's a counter or the edge of a chair, and you basically scrape the tendon or scrape the calf muscle past it, pushing the leg down past the edge, again, pushing the blood back up towards the heart. Now, as a bit of a side note here too, as we go, quite often people, if they do have Achilles tendonitis, they can or they have had foot pain in the past too, more specifically plantar fasciitis. So on that topic, we got a whole separate video for that you can check out there as well. But with rehabilitating anything and everything, with the Achilles tendon here, we've talked about loosening it up. We've talked about flexibility, but we also need to strengthen it. And one of the best ways to strengthen connective tissues to help out with an Achilles tendonitis is to do an eccentric calf exercise. So with this, you want to find a step or the bottom of a stair, and you want to use the involved leg. So here, let's say it's my right leg. I want to stand up on my tippy toes on that bottom stair so the toes are near the edge of the step, so that I can slowly now drop my heel down over the edge of the step. So we want to take about 3 Mississippis or so to drop the leg all the way down. We want to let it have a bit of a momentary stretch at the bottom. Now I don't want to push up with that same leg. I want to switch my weight over to the other leg, so to my left leg here. Stand up on my left leg, point my foot back down on my right leg, so now there's no weight on my right leg, so I can reset. So I'm now back up on the ball of my foot, or on my tippy toes here on the edge of the step with my right leg, and then I slowly do that eccentric or negative rep or down type movement here again. And now again, I'm going to switch the weight back over to my left leg and then repeat on the right side. And we want to do 3 sets of 15 reps with this. Now at the start, I'd advise you the first few times, just do 2. If something is particularly tender, this can make your tendon or your calf quite stiff and sore as well. So you can always transition into it. You can always do more with everything we've discussed in this video, but you can't take it back. And again, afterwards, especially at the start when you're not sure how your body's going to respond, make sure you ice it up after. All right, give this a shot. I hope you find this valuable, and we'll see you later on.